Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 79th episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today I have a very special guest on, my friend and colleague, Terrie Holewinski, excuse me. See, I even practiced before. Dang it. Terrie Holewinski. And she is a fellow kidney stone dietitian, which, as you know, is rare to find. And so I'm super, super excited to welcome Terrie to the podcast.
Thank you, Melanie.
Yes. So let's just start out by just sharing a little bit about yourself. Who are you? Where do you work? What do you do? What do you do in your free time? Just let us know about Terrie.
Thank you. So I've been a dietitian, for about 30 years. And early in my career, I worked at several hospitals in food service director, and then I transitioned into a clinical role. I'm currently working at the University of Michigan, where I've worked there about 22 years. And part of that time, I was a lipid management specialist,
Okay.
but later transferred over to our nephrology department, where I currently work. And I like to say, I think I have the best job at the University of Michigan. I'm so fortunate to work alongside some of our incredible doctors, our nephrology nurses and social workers, my pharmacists. But the best part of my job, I think, Melanie, is working with my patients. I primarily work with patients with chronic kidney disease, stage 3 through 5, as well as patients who struggle with kidney disease. But it's incredibly rewarding to support them on their journey for better kidney health.
Mm-hmm.
And the other part of my time, the other part of my life, I love to travel. We like to travel to our national parks and see the wonders of what the U.S. has. And then I love to sail. So I bought a sailboat a few years ago, and that's what I do on my free time is
Oh, where
sail
do you
on a
sail?
sailboat.
I'm so jealous.
Outside of Ann Arbor, we have a
Yeah,
small
like,
lake, and so that's kind of my happy place.
yeah, that's amazing. I'm sure that I've mentioned this, but as a Michigan State grad, I have to put aside our differences in sports and football and basketball, and mostly football for me is what I really care about. But
Yeah, our daughter
we can
went
still,
to Michigan State, so we can.
yes. Um, awesome. So you have worked in lots of different areas. I did not know about lipid management. That's interesting. And now you've kind of found a home in kidneys and specifically kidney stones. And again, that's kind of a unique situation. So can you kind of describe, because I feel like a lot of times people don't um, understand kind of the difference between a nephrologist and a urologist and kind of their different roles in how they, their different roles in stone care. So can you kind of help people understand what that difference is and how that system is set up at the University of Michigan?
So our urologists are physicians that remove kidney stones. Our nephrologists are more in the preventative aspect of
Mhm.
preventing kidney stones or reducing the frequency of the kidney stones. So we like to say, we love our urologists at the University of Michigan, but we'd rather you see them on a social occasion than having to go see them at the hospital. So
Right.
we need
Because
to try to keep you away from those urologists. And so our nephrologist is working more with preventative care, both working from a medical standpoint and then incorporating me in the nutrition aspect of preventing kidney stones.
yeah, yeah. So, yeah, I feel like sometimes people don't understand because a lot of times people with kidney stones do not have a nephrologist. I would say most don't, and you'll probably talk about that a bit later. Whereas most everyone with stones has a urologist because they're the people equally important, right? Like if you have a stone, like we got to get rid of it and we want to do it well and without harm and all those types of things. But there's a very different role to play, and I don't think people necessarily understand that urologists are not necessarily the best person to go to for prevention.
Yes, many patients are really surprised that they can do something about, you know,
Yes.
not having these stones anymore.
Hmm.
They're only just seeing their urologist just to remove them, not realizing that there's this other part of our medical care that we can actually do some prevention.
Hmm.
So they're really excited by the time they come to see us in nephrology and work with our nephrologist and myself, that they can be proactive
Yeah.
in reducing those stones.
Yes. There are things that we can do, no matter who you are, no matter why you form stones. There are things that we can do to at least reduce the risk of you forming another one.
Exactly.
Yeah. So that's a great segue into my first question, which what is kind of the current state of kidney stone prevention and CKD in the medical system today, would you say? And those are two very big questions, kidney stones and chronic kidney disease. So what are your thoughts there?
So that's a really good question, Melanie. It's really frustrating for me that so many of my kidney stone patients have been treated just for the removal of kidney stones, and not working for the prevention of kidney stones. So by the time patients are referred to us, it's often delayed, and preventing kidney stones should really be a key part of our patients' care. But it's often overlooked until patients have so many kidney stones, or there's a concern that there might be some structural damage before they start to see us in the nephrology department. And I think that's wrong. I think we need to work more in a preventative aspect of kidney stones. And 1 out of every 10 people have a kidney stone at some point in our life. And that's really unfortunate. And so it's estimated that 12% of Americans will develop a kidney stone in their lifetime, and that incidence is rising. And so many of my patients suffer from pain from that results in missing work, or some cases, patients have had stones so frequently that they've lost their jobs
Hmm.
because they've missed so much work. Or they're missing out on these social occasions like family events, or they've had to cancel vacations because they passed a kidney
Yeah.
stone. So, from a kidney stone standpoint, trying to educate not only our patients, but our urologists, let's just try to be more in the preventative aspect
Hmm.
of care for our kidney stones.
Yeah. So much to good pearls in there. I think whenever I do talks for healthcare professionals about kidney stone nutrition, I always kind of start with sort of your standard slides. We talk about how common kidney stones are and how high that recurrence rate, right? Like I think estimates are around 50% of people with stones will have another one in 10 years. And I've seen estimates up to 75% if you look at like lifetime recurrence rate, which is insane. Like I always think like, what if every single person with a stone saw me or Terry? Like how much lower would that recurrence rate be? But anyway, I digress. So, I always start my stone presentations with these big numbers and stats and how they're so expensive. I think the estimate is like 5 billion annually, like economic impact of kidney stones, which is just astonishing. And then I always talk about that sort of emotional living with kidney stones piece because I think that's not talked about and not acknowledged even in medical even doctors and dietitians don't necessarily acknowledge that because I think stones are so it's like, oh, you had a stone. Ha. Like it's almost like a joke, right? Like, oh, that's worse than childbirth. And like it's for some reason there's this almost comedy and lightheartedness around it because I don't think people realize one, like the true health impact that a stone can have in terms of your kidney health, and it's also associated with all of these other chronic conditions. But I think the mental health piece of it is huge, like the anxiety of living in fear of not of passing another stone at any point. So being afraid of getting on a plane or that you're going to miss your daughter's wedding or whatever it is, like that is so, so big. And there's so much potential, I think, to help people be happier with preventing stones, you know?
Correct. I totally agree with that. I totally agree. Um, yes, exactly.
I know, like it's just ugh. I mean, this is why I do what I do, right? Like it's mind blowing that prevention is not a standard part of care for people with stones. And I agree, in my experience, people aren't referred to nephrology until they've had hundreds of stones potentially, or they have CKD because of those recurrent stones and procedures.
Yeah, if they
Um,
had enough kidney stone, that's when the structural damage and then it's then now not only they're dealing with kidney stones, but now damaged kidneys and chronic kidney disease, right?
mhm. Yeah,
So that can be partly preventative, right? There's a possibility that we can be proactive with
yeah,
that.
absolutely. Um, why do you think prevention is not standard when it comes to kidney stone care? Why are we in this situation?
Another really good question.
It's a really big
Um,
one. I apologize for just throwing that
yeah,
out there.
I don't understand and trying to again work with again, I think sometimes in our practice in medicine, we just take care of the problem and deal with the problem, remove the stone and, and have the patient go on their merry way. And I don't know if the preventative aspect of it is always on our doctor's radar.
Mhm.
Um, and trying to get that information, getting that information on the radar that we can do things. And whenever I do see one of our patients that is referred to us from urology, I will let them know that they attended my class or that I saw them individually and we went over their litholing or their urinalysis and we've covered, all these different bullet points on diet. And
Mhm.
in hopes to prevent those future stones. I don't think it's on their radar. And I don't, so trying to get one urologist at a time to understand that what we do
Works.
can
Hmm.
be, impactful. Because we do know it works. And when we work with our patients and when they complete their litholinks, or their 24-hour urine collections, we get reports at the university that is quarterly. And since I've been working and the team of with our nephrologists and urologists, our patients' 24-hour urine collections have dramatically improved.
Hmm.
And so again, I feel like I'm a broken record and just trying to again, talking to our doctors and just making that awareness and always, reporting to them, letting them know what we're doing and for nutrition and what we can do for their patients.
Hmm. Yeah.
And
Yeah. It's so hard because urologists are surgeons and this isn't part of their um it's not their skill set, and that's okay, right? Like we all have different skill sets. Like I'm a dietitian, I'm not a doctor. Like I'm not going to prescribe you medication. You would not want me to do that. Just like maybe a dietitian is the best person to get nutrition education and advice and counseling from. So it just feels like there's this missing connection, because I think there's just a lack of education that kidney stones can be prevented and they can be prevented effectively. Um, and then also perhaps a shortage of healthcare providers, whether it's doctors or dietitians and others that have that unique skill set. Would you think so?
yeah, I think as renal dietitians, we really need to be advocates for our patients and showing our healthcare providers, our urologists or their primary care doctors or our nephrologist, letting them know the role that nutrition can play in stone prevention. Again, one healthcare provider at a time.
Hmm.
And, again, showing what a dietitian can do and
Hmm.
and how we can educate our patients. And showing that, I really think food is medicine, that it can be so powerful.
Hmm.
But our patients also have to be educated and know, and empowered to know that they can make some changes in their life and in their diet and reduce those stones from forming.
Yeah. Yeah, and I think making sure they're getting the right information because, there's so much terrible misinformation out there when it comes to stones, as we know, which another reason is why, a big reason why I do what I do. I find that people are often focusing on 100% the wrong things. So of course it's not working, right? Or they're focusing on something that doesn't matter for them because it's not that particular thing isn't happening in their urine, right? So I feel like people need to work with someone who knows what's going on to really get that right information to know what to focus on.
Right. And we don't want to just give out that generic information or that old school information. And if I hear one more time about low oxalate diets, I think I will pull out my hair,
Yeah.
right?
Yes, I know.
And again, they're just given, the handout on, how to, the traditional old school thought of, you know, following the stone diet, what we can do to prevent those kidney stones and,
Mhm. We can
low
do so much
oxalate.
better.
Yeah. Um, if you would have told me 20 years ago that I was looking at people's urine to look at their chemistry to tell them what to change in their diet, I would have said you were crazy,
I
right?
know, but it's
Um,
so cool.
it is. And when I do stone classes for our patients, we do virtual stone classes. And people just want to know what to eat and
Mhm.
what they should be doing. And they want to know what the good foods are and what foods they need to stay away from. And there is no one specific diet for them, right? So we
Mm-mm.
have to individualize it. And I say, we have 8 folks in this class. And each of you, if we were to see you on an individual basis, each of you would be given your own nutrition prescription of what you should be eating that is going to change your urine chemistry. Because our urine chemistries are so different with everyone. And what can we do to change your urine chemistry to prevent those future stones?
Mhm.
And so everybody's nutrition recommendations are going to be different. And I think, again, realizing that, who would have thought looking at your urine chemistry to tell you what you should or shouldn't be eating or where we should be focusing on dietary changes to prevent those stones. And when patients are completing these 24-hour collections, nobody explains it to them. Nobody explains
How
why they
important
have
it
to
is.
pee in the jug for 24, 48 hours.
Hmm.
It's a kind of a pain. And that itself can be very isolating for 48 hours just to stay at home and pee in a jug, right?
Yes,
Um,
although way better than a kidney stone, I like to say.
for
Way,
sure,
way, way better.
for sure. But when they go through the trouble of doing these 24-hour, 48-hour tests, it's not explained to them.
Yep.
So one of the things that I do with our patients is I review each of those different test results
Hmm.
and number one, what they mean and why they're important. And then what in our diet do we need to change or what should we continue to be doing because your lab or your urine
Looks
levels
good.
is good. So
Hmm.
continue doing that. But trying to pick 2 or 3 of those things that are on that urine chemistry of what we can change.
Yeah.
And in nephrology, our doctors, I call them mother hens because we watch our patients, our kidney stone patients, so carefully.
Hmm.
Our doctors have follow-ups that if they're a new patient, they'll follow up in 4 months and then yearly or if needed. So urinalyses are done. We won't even see a patient unless they have their 24-hour
Hmm.
collection.
Yep.
Patients get a little frustrated with that because they forgot or it wasn't convenient. But again, it's their urine that tells us what to do medically and nutritionally.
Hmm. Without it, we're literally just guessing what we could do to prevent stones.
And that's not good. That's not good patient care.
Mm-mm.
So,
No.
and teaching the patient, and then for them to be able to see, from one time to another, how their urine has changed and how they've optimized their diet. And do they need to continue that their diet changes aren't working?
Yeah.
But also, most importantly, they're not forming those stones.
Right. Right. I think you touched on a really important benefit of working with a dietitian that isn't often thought about, and that is really helping you understand what's going on in your lab results. And this is for like CKD or kidney stones, or probably any healthcare condition, honestly, right? Like, because doctors are super busy, so are dietitians, but dietitians generally have longer appointments with you, and
Right.
we don't have a gazillion other things that we have to address with you. So, oftentimes, I find that a dietitian is the one to help people really understand what that GFR number means, or really help them understand what that high urine calcium is and exactly why we're asking you to eat less salt, right? And really kind of help kind of break it down. In addition to obviously kind of assessing your whole situation and your whole medical history and helping you understand what you should eat, like those are all wonderful benefits of working with a dietitian too. But I really do find that we are often the provider that has the time to really work through those things so you really understand what's going on with your health, you know?
I totally agree.
Mhm.
And I start by asking a lot of questions. And sometimes people kind of look at me a little odd, but it's really important
Weren't you
to,
just going to tell me what to eat?
well, exactly. But I really have to understand your lifestyle and where you are. And also too, where are you in your knowledge of your kidney stones or your kidney disease? And again, we can be at both ends of the spectrum of where our knowledge is. But
Mhm.
knowing that either with chronic kidney disease or with kidney stones, we can be in the driver's seat of better health for
Mhm.
ourselves. But patients have to understand those labs that they're doing, the reasons why those labs are being drawn, or what those results of that urine tests are being done, and to be able to, and not to rely on our physicians just saying, well, your creatinine is up a little bit, or your citrate is a little bit low, so we're going to give you some potassium citrate or have some lemon juice. They don't understand the why. Or
Mhm.
when we're asking patients to have calcium with their meals, right? But they're forming calcium
Makes
oxalate.
no sense.
And or they're taking their they're having their yogurt or they're having their glass of milk, but they're not having it with the meal because in that translation of doing that, they didn't understand why calcium is important, why
Mhm.
they need to be having it with the meal
Yeah.
and not, as a snack. But they checked that box that they did their calcium for that.
Mhm. Yeah.
And so really kind of breaking it down, and I'm a very visual person. I have to really have to, whatever I can do visually to show them what's happening in their bodies and their labs and what their food should look like,
Mhm.
um, is so that they can understand it. And they can, and if they have a better understanding, then they feel much more empowered. And patients will they're not really, they look at me kind of as the food police because they're pretty standoffish at first. Some of them, most of them are very eager, but I have some of those patients that are kind of like,
I don't
Terrie,
want to be here.
I don't, what are you, you're not going to tell me anything differently. But when they learn that, they can slow down the progression of their kidney disease or maybe reduce those kidney, they're starting to sit up a little bit straighter and,
Mhm.
and taking like, oh, you mean I can, if I, do X, Y, and Z, I won't have a stone or reduce the risk of stones because
Mhm.
stones aren't fun. I don't have many patients that want to have another stone or, you know,
No.
so, yes, I've had many men tell me it's worse since childbirth having a kidney stone. And I'm
Yeah.
like, oh,
I've had women tell me too, so I believe it. Yeah, I think it is kind of continuing on that thought, but also going back to what you said about sort of food as medicine. And I always like to preface that with like medicine is medicine and medicine is needed in many situations. But I think food and medicine can work hand in hand so beautifully, right? And unfortunately, that food nutrition piece is often not even addressed or addressed in a haphazard way, which is AKA giving you a low oxalate diet handout from 1965 and calling it good, right? But I think it's really fascinating to think about every single thing that we eat or don't eat. Has to be processed and get rid of somehow, right? So essentially it comes out of us in either poop or our urine, right? Essentially. There's some wiggle room there, but essentially, those are the two places where all of either directly what we ate or byproducts and metabolites of what we eat, that's how our body gets rid of it. And so, of course, nutrition is going to make a big difference in stone prevention because stone prevention is all about changing the chemistry of what's going on in your urine to make it less likely to form stones. And so, all of that food that you eat every day is either going to be putting good stuff into your urine or not putting enough of good stuff or putting bad stuff, right? Like, it's going to have a huge impact on what that urine litholink 24-hour urine test looks like.
yeah, and we do need to make changes and we do focus on change. But knowing and letting our patients know that these are lifestyle changes, right?
Hmm.
And sometimes change is hard.
Yeah, always.
And so,
Yes.
so change can be hard, but again, focusing on just small gradual changes and knowing that for fluids, for example, if someone's only, drinking 30 ounces and I'm asking them to drink 80 ounces, like trying to get 30 ounces and 80 ounces overnight is not a realistic
Hmm.
expectation. But I kind of put like a time frame on it. Well, maybe by a holiday, maybe by the first of the year, maybe by Valentine's Day, maybe you can get to that point. It doesn't have to happen today.
Yeah.
And that again, can it be a little bit reassuring that I'm asking them to make some changes and some of them can be pretty dramatic. Again, if
Hmm.
we're, eating a large amount of sodium or we're not really keen on calcium or, different diet, and it does take some planning and some thought, right? We
Hmm.
can't just go about our day and kind of haphazardly eat. We have to really put some planning and some thought into it.
Hmm.
And maybe we might not be able to have all three meals perfectly, but start one meal at a time.
Yeah.
And that's okay.
Right.
So many of my patients think we have to go right from, to be perfectionists. And I'm like, no, that's not going
What does perfection even mean anyway?
to. Exactly.
You know?
Exactly. So,
Mhm.
being kind and gentle yourself and, again, making these slow, gradual changes
Yeah.
to our ultimate goal of reducing or preventing kidney stones or preserving our kidney health.
Yeah. Yeah. I think that's the other big benefit of a urine test is you'll know exactly what to focus on to get the biggest bang for your buck, right? If you just followed like all of the generic kidney stone nutrition recommendations, it's way too much to focus on. You're not probably going to make effective change in any of those areas. It's just way too much. And chances are you don't need to focus on all those things. You know? Yeah.
Exactly. Right.
Hmm.
Exactly. And yeah,
Yeah, so many benefits. So, I feel like we kind of already talked about this, but what can you do to prevent kidney stones? That was the next question on my list. But we already kind of touched on a lot of stuff. But for people who are listening to this podcast who are like, this is fascinating and this is giving me so much hope. I can do something about it. I've been told so many times I'm just a stone former and just is kind of the life that I'm destined to live. What steps should they take next? What can you do to prevent kidney stones?
yeah, I think if they're seeing a urologist and they're making stones and getting them removed, strongly encourage them to see a kidney doctor, a nephrologist, and start with that prevention. And then again, in working with a dietitian, ideally in conjunction with the nephrologist, I work really closely with my nephrology team. And it's important to have that team cohesiveness because what my kidney doctors are telling them is I'm telling them, so they're hearing the same
Hmm.
message. So working with, a nephrologist that specializes in kidney prevention, working with a dietitian that is knowledgeable about kidney stone prevention and from a nutrition standpoint, completing those 24-hour urine collections and understanding what those numbers mean, what those test results mean as far as the urine, and start to make those slow, gradual changes as we learn about the urine analysis and what in our diet we can make those changes.
Hmm. Yeah. Yeah, absolutely. Yeah. And that's why one of the reasons I'm so excited. I'm not even no, I don't know if you know, Terry. I have now a team of dietitians, kidney stone dietitians who see patients, which I'm so excited about because we know that in reality, many dietitians, most dietitians do not know about kidney stone prevention. It's not part of our standard curriculum, right? Like we
It
have
is.
to learn about diabetes and high cholesterol and inflammatory bowel disease and all these things, but kidney stones is definitely not on there. And so it's in reality, and many urologists don't partner with dietitians or even nephrologists who specialize in stones. And so that's why I'm so pumped to be able to offer kidney stone dietitians to the world. So I have people who are would love to work with you if you're listening to this podcast to help you figure all of this out from a nutrition standpoint.
Yes, I agree. And thank you for everything that you're doing and spreading the word. And I've listened to your podcasts over the last couple of years, and I love listening to your podcasts and listening to you. I can't listen to you enough because
Oh,
every I listen to, I get another little pearl of wisdom. And when we talk about what we can do from a nutrition standpoint, and I teach a kidney class at the university. Um, a lot of my patients say, Terry, this is a lot, and I think I should get a college credit from you from the university.
potentially.
And I'm like, well, I'll work on that one. But it's hearing things, once, twice, three times. The more we can hear things, the more information that we can get from credible people that work in our profession that practice kidney stone prevention. the more we hear it, the more it's going to become more common and become more best practice and become part
Mhm.
of our normal lifestyle again.
Yeah.
So,
Yeah, absolutely. Awesome. Well, as we close up this podcast, any last thoughts or words that you want to leave people with?
I always tell my patients, especially with my kidney stone patients, don't let kidney stones manage you. You manage your kidney stones. We can
Take control back.
take that control. Um, and working with healthcare providers that listen to you and are treating you with a multidisciplinary team, working with your dietitian, working with your nephrologist, working with your urologist as you need to, but being comfortable with your team members and
Mhm.
being
Yeah. Yeah. If you aren't being heard, if your doctor is not ordering 24-hour urine tests, even after you ask them to, get a new doctor. Um,
thank you for that.
right?
I've actually had patients ask their urine and I've had doctors return and say, Terrie, there's no need for that
I
urinalysis.
every day I hear that. It's infuriating. The worst response yet was someone who, reached out to me on Instagram. I said, okay, get a urine test. And they came back and their doctor said they didn't want to do it because then they would have to fix the numbers. Yep. You'd have to prevent stones. You'd have to do something about it. Like that was just on one hand refreshingly open, I suppose, like very honest, but also just I was
Wrong.
so angry. I was shaking. Yeah, but yes, and not all doctors. I feel like most doctors want to help you, right? Like just like most people are good. Fully believe that. Most people want to help you, and most doctors will get those 24-hour urine tests if you ask. There's some sticklers, but the point is, if you don't feel heard, if you feel just like a number, if you just feel dismissed, and if you are told that you are just a stone form and there's nothing you can do about it, you need to get a different doctor, a different dietitian, or whatever it
Get a
is.
second opinion for sure.
Mm-hmm. Yeah. Yeah. Okay. All right. So with that, I will close this episode of the podcast. If people do have questions, where can people find you, Terrie? Can they reach out to you?
Oh, please, of course. I'm still at the University of Michigan, so they can always reach me through the University of Michigan. And I've also started my own online business called KidneyIntel. Um, I have licensed all my patient education material from the University of Michigan. You will see my Kidney Essentials class that is available online digitally for purchase. And I have a website that just got put up in
Congratulations.
November, kidneyintel.com.
Okay.
So it's my website. I have big plans for Kidney Intel. It'll be primarily for chronic kidney disease, but I might sprinkle some things in for kidney stones.
Yeah.
But yeah, I'm super excited.
Oh
So
my gosh, that is so exciting. And I will link to that in the show notes of this podcast so people can easily find you. So
please, thank you so
that
much.
is so exciting. Thank you, Terrie, so much. This was such a fun conversation. I loved having you on the podcast. I think that people will get a lot from it. And thank you to everyone listening out there. I hope that you enjoyed our conversation and you're feeling hope and motivated that there are, in fact, things that you can do to prevent stones. You just need to find the right team, essentially. um, and so, with that, I will close this episode of the Eat Away Kidney Stones podcast, and I hope to see you next Wednesday. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.